Today we're going to talk about how can you tell if your back pain is kidney related. So basically, many a times kidney pain and back pain can present in the same area in your back, and it can be a little challenging to tell whether your back pain is coming from your kidneys or it is from the spine and the back itself. So, before we dive into the topic for today, for those of you who don't know me, my name is Swati. I'm an executive mom power coach. So, basically, I help moms who are working as executives manage the physical challenges that come with motherhood. Now, this could be anything from neck pain to back pain to incontinence because of a weak pelvic floor, or really everything in between these. So, yeah, going back to our topic for today, how can you tell if your back pain is kidney related? So, basically, is your back pain because of your spine and muscles, etc., or is it because you have a problem with your kidneys? So, now back pain is so common in today's society that every other person has had back pain at some or the other time. Probably it's a stagnant lifestyle, probably it's the fact that we sit a lot. You sit 9 to 5 at your desk, you're sitting when you come home and watch TV, you're sitting when you're driving. I mean, sitting takes up a lot of time in our 24 hours. So, yeah, so back pain is quite common because of these things. Now, we are talking about the kidney, so let's get back to that. So, what exactly are they? So, just to break it down into very simple terms, they are basically we have a pair of kidneys that are present on either side of. I mean, if this is the spine, you have kidney on one side and the other one on this side. So, basically, kidneys are a part of your urinary system. So they filter the urine and then it is passed out when you go to the toilet, right? Now, what happens is you can have issues in the kidney like urinary tract infection. So, basically, infection around there. You can have cancers, you can have stones, kidney stones, etc. So, I'm not going to go into the details of why you have kidney problems. That's basically something that if you have a kidney issue, then your doctor must have discussed with you, anyways. But what happens is the kidneys are located in your back. As I was saying, it's on either side of the spine. So if you can feel the last few ribs in your back, so when you touch your back and you feel that last rib, so right under that last rib on either side of the spine, there is where your kidneys are sitting. So more towards the spine. So if this is your spine and this is your rib, so they're sitting more around here rather than the outside. So more towards the inner part, towards your spine. So, because of the location of the kidneys and the common occurrence of lower to mid back pain in our society, it can be challenging to tell where your back pain is originating from. So, usually, if you have kidney pain, generally speaking, the pain is more deeper. If you've had back pain at any time in your life, you can tell that it is, on the surface of the back. It can feel like it is a little bit deeper, but kidney pain feels really deep because that's where your kidneys are located, deep inside. And kidney pain can most of the times it can, if it radiates, that is, if it travels, it goes into your abdominal area. It can go into your groin area as well. But usually, if you have back issues, especially lower back pain, that pain will radiate into your bottom, into your legs, your thigh and your calf, or the front part of your thigh and legs, and it can even go down to your feet. Kidney pain will not go right down till your feet. Okay, so that is one distinguishing feature, as in one feature that can tell you whether you have back pain or you have kidney pain. The other thing is usually back pain, if you have a problem with your spine, now it really depends on what is the problem with the spine. Back pain will either be central or onto the sides. So kidney pain, usually you will not feel it centrally, you will just feel it in the sides or in the abdominal or groin area. So that's also, it's a little vague, the difference between the two, but that's also something that can tell you whether you have a kidney pain or a pure back pain. Just looking at my notes here, yeah. So other thing is that with kidney issues, usually people have other symptoms, like they will have a change in the color of the urine, They might have blood in the urine. They might feel blockage when they go to the washroom, as in when they're passing urine, or they might feel that they need to go to the toilet more often than usual. So obviously a doctor can give you like a diagnosis if you have a kidney problem or you don't. But if you have a back pain and somewhere in your mind you're thinking, oh, is it my kidneys or is it my back, this is something that can sort of give you a little bit of a baseline before you actually go to your healthcare professional or your doctor, and then they can help you manage it if it's a kidney issue. Now, if it is a back problem, whether is it from your disc, is it a stenosis, is it arthritis, is it just a sprain or a strain in your back muscles? How can you tell if it is from any of these structures in the back? So what I did was I made a free PDF that tells you where is the source of your back pain. So what I'll do is I'll leave the link to that free PDF in the description of this video. When you click on that description, it'll open up a new page where it'll ask you for your name and email. The only reason for that is because I'll send you the PDF over email. So I promise not to send you junk mail, definitely. But yeah, I'll leave a link in the description. And for those of you who are watching me on Instagram, if you go to my bio and you click on the link, it'll open up another page where it'll say um, free resources. So you can go and click on that and you'll be able to find the one for the what is the source of your back pain. Alrighty, I hope that was useful for you guys. And yeah, I'll